Morning. Welcome to the OEP's Lunch and Learn for this week. And my name is Scott Shahan. I'm the Occupational Safety and Health Manager for VDH. And we're going to do a little conversation about respiratory protection in the workplace today. If you happen to join by Polycom and registered and trained, email EP&R training@vdh.virginia.gov following the Lunch and Learn in order to be verified in training. Or if you didn't register, please also email that one to let them know that you attended, so you can get verified and get credit for the Lunch and Learn. And again, thank you for showing up and being on the screen today. I do have somebody monitoring the chat, so if you put any questions in the chat, we'll follow up with those as we can throughout the presentation. Plus, there'll be a Q&A period at the end to see if I get any feedback or anything you want to bring up about respiratory protection in the workplace. So that being said, let's move on. When we talk about respiratory protection, workplace standards, we throw around the term OSHA a lot, Occupational Safety and Health Administration. That's the federal group. And for respiratory protection, it's 29 Code of Federal Regulations 1910.134. Now, if you're looking at the screen, you also see up there on the screen a Virginia Code section, 16 Virginia Administrative Code 25-60-120. The reason I have that up there is Virginia is what's called a state plan state. When we talk about OSHA, we talk about VOSH, Virginia Occupational Safety and Health. Department of Labor and Industry monitors that, inspects workplaces, and runs the compliance program for that in Virginia. What that code section in Virginia Administrative Code does is it adopts by reference the general industry standards from 29 CFR 1910, the general industry standards. So when we need to see the details of the standard, we go back and look at the Federal Register and look at that standard. In the case 1910-134 for respiratory protection. But when we are complying with it, we are actually complying with Virginia Code. So personally, I don't care whether you use the term OSHA or VOSH, they're interchangeable as far as what we're talking about. There are some Virginia unique standards that apply only in Virginia versus the federal standards. However, respiratory is not one of them. So the sections within the standard allow for a standard level of respiratory protection in workplaces. Employers provide respirators to employees when there are recognized hazards and it is required to wear a respirator. And the employer shall be responsible for the establishment of a program and the maintenance of a respiratory protection program in the workplace. And I want to point out, in case you're not familiar, the term shall, when it appears in a standard, which is a law, shall means we have to do it. If we see a should, we have some leeway, we can determine how best to do that, but when we see a shall, we have to do that. So respiratory protection program is broken down by elements. In this case, there are 8 that we're talking about for the respiratory protection program standard. Those 8 elements: written program, program administration, respiratory selection, medical evaluation, fit testing, respirator training, maintenance, which includes storage, cleaning, use, and inspection of a respirator. And then something a lot of people fail to realize with their programs is you have to have some form of program evaluation as well to look back at your respiratory protection program, make sure it's effective. So these programs, some of them have a lot of shells in them when you get into the standard and reading there. The employer shall develop a written program that has worksite specific procedures when respirators are necessary or required by the employer. Must update that program as necessary, so that program evaluation becomes very important in being able to look back and is your program effective, or if workplace conditions change, as they did in 2020, 2021, workplaces conditions changed dramatically, so programs had to be updated according to those changes. The employer shall designate a program administrator. Now that program administrator position is kind of tricky because that person is not just somebody who's going to do the paperwork. Program administrator is somebody who needs to be qualified by appropriate training or experience to administer and oversee the program and be able to conduct the required evaluations within that program. So it's more than just a paperwork position. When we identify a program administrator, it's somebody who's very, very important to the system. Now, we're not going to go over all of these elements. This is a little 30-minute lunch and learn today. So I'm going to touch on 3 of those elements, 2 in particular detail and 1 some overview. So we're going to talk about medical evaluation to start with. Prior to being required to wear a respirator in the workplace, there are lots of things that have to happen from an employer standpoint. But we have to understand that respirators place a very strong physiological burden on the user. The burden varies, type of respirator being worn, the job or workplace where the conditions change or are extremely variable, and actually the medical status of the wearer itself also can change those those burdens around a little bit. We're talking about pulmonary, cardiovascular, body temperature, senses, physiological and psychological changes, irritation and allergies, all come into play in that medical evaluation for a respirator wear. We have to obtain some type of medical clearance from a physician or other licensed healthcare professional. That's PLHCP for those that like acronyms. That PLHCP has to gather information from the employee in some way. The standard says that we have to start with a medical questionnaire, and it's very specific as to what questions have to be on that questionnaire. As a matter of fact, if you look at the standards, it is one of the appendices to the 1910.134 federal standard. The questionnaire is mandatory. Now, it has sections that are not mandatory, and it has sections that are mandatory within the questionnaire itself. Sections 1 and 2 of the questionnaire are all mandatory. That's the information about the employee, the workload, their experience wearing a respirator, and then section part of that is the actual physiological questions that are asked of an employee, such as, do you smoke? Do you smoke tobacco products? Do you have any of a certain list of conditions, asthma, COPD, a few things along those lines. Those questions are mandatory. Then there are other sections within that questionnaire that provide some optional questions that can be inserted by the physician or other licensed healthcare professional that's going to review the questionnaire. So that PLHCP also has to be very knowledgeable about the requirements to wear a respirator, the physiological demands of wearing that respirator by a user, and the workplaces where they're going to wear the respirator. Now, they don't have to necessarily work in those same workplaces, but they have to be given information on what that person's going to be wearing the respirator for, the physical demands of wearing that respirator and doing work in that respirator, even down to things as, is it a high humidity, a high altitude area. All those things have to be given that information to the PLHCP for them to evaluate that wear. You notice on the screen, I have an exception under required respirator use. There is a section in the standard for when respirator use is not required, but an employee still wants to voluntarily wear a respirator. If it's a filtering face piece, such as the N95 respirator, that voluntary use doesn't necessarily have to have a medical clearance or fit testing, but there is specific information that must be given to the employee that voluntarily wears that filtering face piece respirator. Now, for other respirators, such as a tight-fitting half-face respirator, elastomeric, or a tight-fitting full-face respirator, there is requirements that there still be a medical evaluation even for voluntary wear. So we're really focused on that voluntary wear in our places if it happens to be only an N95 respirator. So that's a exception to the policy, but it only applies when it's not required to wear the respirator in the workplace. Also, there's questions in the OSHA example of a questionnaire that are optional that can be added by that PLHCP to the questionnaire for a particular work location. In the case of some places where you have a high post-military group of employees, oftentimes the PLHCP will insert questions from that list dealing with post-military exposure to hazard airborne particulates or respirator wear, because that will tell them more about that particular wearer's medical history and ability to wear the respirator. So medical evaluation must be performed before the employee wears the respirator for work and gets assigned to wearing that respirator. Now, obtaining that medical clearance, and it could be, it's titled oftentimes a medical recommendation, but it is a medical clearance to wear a respirator, starts with a questionnaire. But it can be done through a medical exam, as long as that medical exam gathers that same information from the questionnaire. Or a medical exam may be required as a follow-up to the questionnaire if the PLHCP determines that there's more medical evaluation needs to be done. That's a conversation between the PLHCP and the employee or the wearer during the medical evaluation. Part of that questionnaire is also that the employee be told who and how to contact the PLHCP that's going to be reviewing that questionnaire. So all that information has to be shared with the employee. So after the wearer has gotten a medical clearance and approved to wear a respirator in the workplace, besides training, which we're not going to get into the specifics of the training program, but we're going to jump to fit testing. Fit testing is a determination prior to initial assignment of wearing the respirator in a hazardous environment, after their medical evaluation, of making sure the respirator fits the employee and it's the appropriate one, size, make, model for their face, for their structure, and that they can get a seal with the respirator. Fit testing must always be the same make, model, and size that they're going to wear in the workplace. There are other specific requirements to when they get fit tested besides initial assignment to the respirator. They must be annually fit tested. And remember, when we talk annually, we're not talking about once a year. Annually means once every 12 months. So you can't fit test somebody in January one year and the next year fit test them in June. That's not annual, and that's once a year. Annually is once every 12 months. Also, you fit test someone when you change the make, model, and size of the respirator they wear. I know this became a big topic during COVID when the supply chains were so screwed up that you couldn't often get the same respirator from week to week or month to month. So you actually have to fit test on a different make, model, or size of a respirator. In those cases, hopefully, we don't run into that same supply chain now, but there may be changes in the future that a manufacturer makes to a make or model. We have to fit test even if it's not due for an annual. Also, if there's noted changes to an employee's physical appearance, their physical condition, excessive weight gain, excessive weight loss. Now, we usually tie this to around 20 pounds, but everybody's a little different. It's looking at their face, looking at the structure. It could also be other physical conditions if they've been involved in an accident and they have some facial scarring, or they've had a lot of dental work done and their teeth structure and their jaw structure has changed. They may need to be fit tested again. Also, an employee can request to have a fit test anytime they want, or they need to update their fit test. Also, the program administrator may need to determine that we need to fit test again, or the PLHCP can recommend that someone be fit tested outside of the other required times for fit testing. Also, a should that shows up in fit testing requirements is user seal check. The user seal check is the only tool that a wearer has in the field to make sure they have a good respirator seal when they put it on their face. There's a positive and a negative user seal check that's done every time you put your respirator on. You cover the filter. If it's an N95 filtering face piece, you have to cover the whole filter. If it's got canisters, you cover the canister inlets. And positive pressure is you blow out gently, covering the exhalation port. In an N95, you're covering the whole filter, and you exhale gently. You should feel the mask puff up. You should not feel leaks around your seal of your mask. Also, the negative pressure is you cover that inlet and you pull in, suck in gently, and the mask should pull in against your face slightly. You should not feel leaks around the seal of the mask. Those user seal checks should be part of your fit test procedures when you are fit tested, or if you're doing the fit testing, because that demonstrates that the wearer understands what the seal check is for. It's part of the training, it's part of the practical. It's not listed as a requirement in the fit testing, but it is a should. It's the good place to do it. You're in a clean environment, you're checking the seals, you're checking the fit. That's a good place to do it. The mandatory procedures for fit testing are contained in that 1910.134, the OSHA standard on respiratory protection. It's one of the appendices to the standard. It is also mandatory. The steps to conduct a fit test are the required steps of the law, of the standard. It spells out how you do the fit test, how often you do the fit test, and each of the steps throughout the fit test procedures are followed in that fit test. There are different types of fit testing that are available. There's quantitative fit test and qualitative fit test. Quantitative fit test, QNFT, is actually a measure of the level of contaminants inside and outside of the respirator, and it provides a numerical fit factor. There are devices that you actually connect to the respirator when it's on the wearer's face, and they go through similar exercises to the qualitative ones during a fit test. And the device is actually taking a measurement. In the case of the port count, it's doing a condensation nuclei counter, or CNC. It's measuring the particulates inside and outside the respirator and provides a numerical value for how well that mask fits. Qualitative fit test is using the challenge agent, some type of vapor or aerosol. Most people are familiar with Vitrix, which is the bitter aerosol. We also use saccharin, which is the sweet aerosol, but there's also isomyl acetate, which a lot of people refer to banana oil, which is another challenge agent that is used. Those challenge agents all follow very similar steps, using a hood, using a nebulizer to aerosolize the agent inside the hood. The person has to be able to taste the agent, or smell the agent, and then with the respirator on, they're not supposed to be able to sense the agent. One other that you don't hear a lot about from a qualitative fit test perspective is you can also use what's called irritant smoke, and it is a fit test challenge agent, but you don't use a hood over top of the person because you are actually, the device generates smoke and it has a heat source in it, and you don't want to put that inside a hood with somebody's head. So we usually stick here at VDH with Vitrix and saccharin. Just a caveat, there's about 5% of the population can't taste Vitrix, they don't taste the bitter, and about 7 to 8% of the population can't taste sweet. And if somebody's had COVID recently, they might not be able to taste anything at all, so we have to take that into consideration when we use the qualitative fit test procedures. One of the other elements within the program is respirator selection. Not going to spend a lot of time on this because we do talk a lot about the N95 respirator, the filtering face piece respirators. On the screen you'll see a couple of different styles, round ones, ones with exhalation valves, which we discouraged during COVID, but those are still respirators and still available, and flat folds or bifold N95s. Now, what a lot of people don't realize is that N has a lot to do with what this respirator is good for. There are actually 3 letters, N series, R series, and P series for N95 respirators. Also, you can have an N99 or an N100 filter as well. The N, R, and P stand for N is not resistant to oil. So in an environment where you're going to have oils, a laboratory, auto shop, any area where you're out and about, if somebody's going to a manufacturing facility or a food processing facility, they're going to be exposed to machine oils. N95 is not the one to wear. R might be because it's somewhat resistant to oil, or a P100, which is strongly resistant to oil, may be the respirator that's needed in those areas. The employer is responsible for identifying the respirators that are needed. In some cases, people either have a facial issue, such as facial hair, that they aren't going to get rid of, that interferes with the seal of the respirator, because according to the standard, nothing can interfere with the seal of the respirator. No facial hair, no personal protective equipment, anything like that. The seal between the respirator and the skin. So sometimes we have to go to a powered air purifying respirator, and there's an example on your screen of a hood, a loose-fitting hood, set up for a powered air purifying respirator. The one thing you don't have to do with a EP&R, but you have to do with other respirators, is you don't have to do a fit test with a EP&R, a loose-fitting EP&R, because there is no firm seal for that respirator. And one last little note about the selection for respiratory protection is that, remember, surgical masks are not respirators. You can have a respirator, especially an NRP 95, 99 or 100, that is also a surgical mask. Those will have not only a NIOSH approval, National Institute of Occupational Safety and Health respirator registration approval, but if it's a surgical mask as well, it will have an FDA approval on it as well. Not every N95 that's a surgical mask, or not every N95 is a surgical mask too. It has to have both the NIOSH approval and FDA to be a surgical mask. But just remember, the standard surgical masks are not respirators. There are requirements for an employee's responsibility within the standard. It's our responsibility as an employee to wear the respirator with the way we were instructed to do so during training. It's our responsibility to maintain it, clean it, inspect it before we wear it, store it, dispose of it correctly, as we were instructed during training. If our respirator is malfunctioning, we're responsible to report that to our supervisor so they know that we've got a problem with our respirator, or if we're having any other kind of problems, not just malfunction. And if at any time your respirator malfunctions while you wear it, we have the responsibility to get out into a clean area, away from the hazards, and then take our respirator off and not go back in until we've fixed that as malfunctions. Just like the employee responsibility, the supervisor has responsibilities as well. Make sure the respirators are used in accordance with the training. Supervisors need to make sure their people are wearing them when they're supposed to and how they're supposed to. Make sure respirators are maintained clean in a sanitary condition. And make sure respirators are available, that if an employee needs a replacement, needs to know where they are, needs to get them, the supervisor is responsible as the employer's representative to provide those respirators. So we need to follow up on that if we have to. We've made lots of progress in respiratory protection over the years, from the original gas mask to take care of mustard gas and those kind of things in World War I, up through some not so good things with the vest pocket respirator of the 50s that just went over somebody's nose. So we learn more every year about respiratory protection. Respirators have changed, they continue to change. So what we have to do is make sure we're staying current and the hazards that we have in our workplaces are identified and recognized, and we take care of the respiratory ones with respiratory protection. Any questions at this point? That's kind of everything I had for you all in a nutshell today. Donald, any
They can
chat questions?
No, they can send anything.
Now would be a good time, if you have any questions at this point, to go ahead and type them in the chat. Or you can unmute yourself and ask the question while we're on here. I know we're not hearing anything so far. I'll talk a little bit. There's still a couple of minutes left to go in our time. We will be providing within VDH some updated things dealing with respiratory protection. The occupational safety and health team has been preparing an updated policy that includes some electronics versions of the medical evaluation questionnaire to remove some of the hassles that showed up during COVID with who could clear and the person can't be in the chain of command kind of thing. The PLHCP has to be someone who doesn't see the employee's medical records, those type of things. So be on the lookout for that. Couple of points while we're still waiting on some questions. When you fill out a medical questionnaire, or you have an employee fill out a medical questionnaire for respirator clearance, that document is a health record. You can't email it without, it has to be securely emailed if you're going to email it. It is a medical record, and it must be retained as such. So it needs to go in the employee's health record, not their HR record. However, the medical clearance or the medical recommendation for that employee to wear a respirator is not health information. The only thing on that clearance document is the employee's name, identifying employee number. Yes, they can wear a respirator. No, they can't wear a respirator. Yes, they can wear a respirator with specific limitations, such as, an example would be they can only wear it for 2 hours at a time, or they need further medical evaluation. There is no medical information on that clearance questionnaire, so it is to go back to the supervisor and the employee to maintain and document that that employee is able to wear the respirator. Any questions? Okay. Thank you all. Nobody's piped up with any questions. I appreciate it. I know that Donald is going to send out follow-up to this to people that registered. He will include the PowerPoint presentation, and some of the notes pages will be in there too. And I put my phone number on the first slide, so you all are more than welcome to reach out to me directly. Also, scott.shahan@vdh.virginia.gov. So I'm in the address book. Any questions on occupational health and safety, respiratory protection in particular, or any workplace safety and health issues, send them to me. Thank you all.